The following is a college telecourse based on the textbook Psychology, written by Dawn and Sandra Hockenberry and published by Worth Publishers.
She can make a move. Oh, go on him.
Linda Minkoff has a job that she loves, friends, and a wide variety of interests. But like many people, even though her life is full, it is not fulfilling. Over the past several months, she has run into a number of problems that are making life difficult to enjoy. After struggling with matters on her own and finding little relief, Linda is now wondering whether she should seek psychotherapy. But what kind of psychotherapy? What kind of help is available? And what can Linda expect from it? Over the next 12 months, 1 out of every 3 people will show some of the signs of a psychological disorder. For some, the problems may be severe: clinical depression, obsessive-compulsive disorder, a life-limiting phobia. For most others, the symptoms will be less severe but still distressing, like Linda Minkoff, an average woman going through a difficult time after a divorce.
My life right now is completely different from how I ever thought I'd be living. In some ways I love it, in some ways it's definitely a challenge. I'm a nanny. I love being a nanny. But I'm single, and I'd never anticipated being single, living here, having to support myself. I've never supported myself before, so I'm having to relearn how to take care of myself, basically. And be completely on my own. I've never been completely on my own before. Well, recently he got remarried, and this is a man that said that he shouldn't be married. So that's been difficult for me to deal with. I'm eating too much. When I kind of get down a little bit, I spend too much money on things I don't really need. I have had some difficulty sleeping. And basically, my energy level is just not where I want it to be. I feel tired and kind of down all the time.
Linda's problems are not uncommon. Virtually all of us will face major transitions at some time in our lives. And in coping with them, we may develop symptoms of a psychological disorder. But most of us will not seek professional help. As little as 100 years ago, that would have been understandable. People with disorders faced treatments that were often more unpleasant than even the worst symptoms. But today, people are likely to find relief through psychotherapy, medication, or a combination of the two. The types of psychotherapy vary, but they all share the assumption that psychological factors play a significant role in a person's emotional, behavioral, and interpersonal problems.
Psychotherapy is a helping relationship, typically with between an individual and a mental health professional, where they meet together and work together, talk, ask questions, explore avenues of the person's life, and the two work together collaboratively to hopefully reach some goals.
There are many types of psychotherapy. The most influential approaches are psychodynamic, humanistic, cognitive, and behavioral. While each of these uses different methods, they share the common goal of producing beneficial changes in a person's life. When a person like Linda seeks psychotherapy, she may get different types of help depending upon the therapist she sees. In order to provide clear examples of these different approaches for this program, Linda agreed to go to 3 different therapists. Linda's first appointment was with Stephen Sultanoff, who chose to use a humanistic model.
The goal in humanistic therapy is for the therapist to create a relationship with the client so that the change agent becomes the relationship rather than any other technique. In doing so, what I'm doing is a lot of reflecting. For instance, I'm reflecting emotion. You're feeling upset, you're feeling angry, you're feeling sad or hurt, as a way to help the client to experience my understanding of their process. And that's how the humanistic model works, is as the client experiences me understanding the client, then the client gains understanding for him or herself. Linda, we've been talking for a while, and I wonder right now, where would you like to go in terms of utilizing the time that we have together?
You know, what's really bothering me is not being able to let go of my former husband. And he's definitely moved on. He's remarried. And it's really hard for me to let go of that.
So part of it for you then is to be able to let go of the marriage in order to free yourself to be available to move on to a new relationship.
Right. I know there's a lot I haven't completely healed from.
Mm-hmm. Okay. And tell me about the part that you haven't healed from.
I mean, having a really hard time dealing with the fact that he's remarried and that he's not with me. That he's with somebody new. And I don't even know how to put that into words, what I need to release about that. Other than I thought that we would be married for the rest of our lives.
So you thought you'd be married for the rest of your life and married to your soulmate, and now he's married to someone else.
Right.
And when you think about that, how do you feel?
Obviously I'm tearing up, so it makes me feel sad.
And not just sad, but like really sad. And you feel really sad because you had hoped and you expected that the two of you would be together forever, and that with the end, now he's with someone else.
Right. I always thought whatever happened, we could work it out.
Right.
But it takes two people to work on it.
Yeah.
And that didn't happen. We worked together for many years. And when he started pursuing a career in music, we didn't work together anymore. So I think that we grew apart. And that was part of the problem, if not all of it, really. So I wasn't expecting that. I never thought I'd be living here. It's just been a lot of changes in the past 7 or 8 years.
So there have been a lot of changes in the past 7 or 8 years, and part of it you didn't expect, like for him to go off kind of do his own thing, which sounds like over time caused the two of you to drift a little bit.
Right. Oh, yes, because I was working 10-hour days, and he was trying to pursue a career in music, so he was doing a lot of schmoozing and, talking to different people, and we weren't together anymore. And so it kind of left me at loose ends.
And with that leaving you at loose ends, it meant the relationship ended, and now what you're not able to do is let go. That's what I'm hearing that you want to be able to do.
Right.
Is let go of the relationship.
Completely. I've let go of most of it, but somehow there's still little tentacles. I'm just have strings attached to different things, I think.
When you say strings attached, I understand that the tentacles, the strings attached. You just said strings attached to different things.
Well, to different parts of the relationship. And I couldn't even tell you exactly which ones they still are. Because in one way, he's not in my life at all anymore. I don't speak to him. I haven't seen him in like almost a year. And I think that leaves a kind of a open. He was my best friend.
Yeah. So when you talk about being lonely, the part that really lonely, and it sounds like was your best friend. That's the loss of that soulmate part.
Right.
That seems like the part that really hurts.
Right. And that's the part that that's hard to let go of.
Right. With Linda, I didn't take a specific course of action. The client becomes my guide. So as I worked with her, I was attempting to become a mirror reflecting her depth of emotion, and that would allow her to explore more deeply into her emotion.
A few weeks later, Linda visited Christine Podesky, a psychologist who practices both the cognitive and behavioral therapeutic approaches. While the humanistic approach focuses on self-awareness, The cognitive and behavioral approaches focus on changing how a person thinks and behaves.
Cognitive means thinking, and in cognitive therapy, we pay a lot of attention to the thoughts, beliefs, and meanings that people have. The reason we do this is because the meanings we have for events in our lives have a strong impact on our emotional reactions, our behaviors, and even the physical responses that we have. Behavior therapists look at behavior and what factors in people's lives either serve to maintain behavior or help make changes in behavior. Oftentimes, therapists who do use cognitive methods also use behavioral methods, so we call them cognitive behavioral therapists. There's two issues that are kind of on your mind today. One issue is that you realize you still have some anger and bitterness towards your ex-husband and toward what happened and ending your relationship with him. And the other thing is that you kind of want to resolve that for yourself so that you can move on in the future.
Exactly. I don't think I can be happy unless I get all of that out and really look at it, deal with it, and let it go.
So tell me a little bit about this anger and bitterness.
Well, I feel like he reneged on our deal, that he decided for his own reasons, mostly, I don't know what his reasons really were. But for whatever reason, he just decided it wasn't worth working on it anymore. And that makes me very angry because I trusted him.
Okay, and what does that mean to you if he did renege on the deal? What does that mean
Well,
to
it means
you?
can I really trust anybody, what they say? People have good, they mean well. Nobody gets married thinking they're going to get divorced. But we both had been divorced before, so I thought he was more serious, like I was, about really, truly making it work.
So you kind of feel like you thought you knew him pretty well, and if he reneged, then maybe you can't trust anybody to follow through.
Yeah, exactly. Yeah, but I hadn't thought of it that way. But yes, I trusted him more than anybody ever.
So the stakes are pretty high. That's an important person to then betray you in a way, because then you don't know if you can trust anybody. And I think that's part of what happens when we have such a loss, because you and he were together how many years?
17.
17 years, that you have such a loss that it's not just the loss of that person, but it sounds like you lost, in some sense, your faith in humanity.
Yeah, I think that's true. And my faith in myself, that maybe I wasn't such a good judge of character. And that's really hard to deal with that. Feeling like maybe I didn't have such great judgment, or how could I be so wrong about somebody?
Okay. Again, I'm going to ask us to kind of pick a direction here, because we've got two themes going. One theme is this theme of if he reneged on you, maybe you can't trust anybody. And the other is this theme of trusting yourself and your own judgment. And if you think about it, Linda, is one of these themes, do you think, more driving behind the anger and bitterness you've been feeling than the other, or are they both equally important?
No, I think I'm more angry at him.
I'm not getting a sense, Linda, of what's making you so angry. I mean, I understand there's this sense of betrayal, but I guess I'm not clear what the piece of it is that really makes
Why
you
I'm angry?
Yeah.
Good question. I think angry because he didn't keep his word, and he wouldn't even. I know what it is, because for the 2 years previous to him leaving, I knew something was wrong and things weren't going well, and he was depressed, and I tried to get him into therapy with me to work it out, because I could see we weren't getting anywhere. I wasn't able to reach him. And he didn't want to do that. He was, for whatever reasons, thought I wouldn't help. And he never said, yes, we need this. So he never gave me a chance. That's what it is.
That hits you emotionally, that sense that he didn't give you a chance. Not so much that the relationship ended. Maybe if you'd given it a full chance and it ended, that would have meant something different.
Exactly.
But he didn't even give you that chance.
Right. He just made up his mind, and that was it. And that's what makes me the most angry.
Yeah.
So it was unilateral decision at that point.
Kind of left you out of that.
Yeah, but at least if he got into therapy, I would have felt like he tried. And that we put the effort.
Yeah. And that's the part that was missing, that sense that he was willing to at least put in the effort with you after all that time together.
Exactly.
Yeah. So that's really fueling your continued kind of anger and bitterness right now.
Yeah,
and
it is.
I'm wondering what you think is necessary for you to be able to let go of that.
Well, getting in touch with it's the first step. And I really hadn't realized that's what it was so much.
One of the main things I think I did in the session with Linda that was helpful is I tried to help her clarify her meaning systems and what some of the meaning was behind some of the difficulties that she was having. In a future session, I would probably begin to work with Linda more on some of the behavioral changes that she might make in order to achieve the goals that she sets for herself. But until Linda understands more her emotional reactions and the meanings that those have for her, it's a little bit premature at this point to begin to do behavior change.
Even though psychodynamic therapy was the first psychotherapeutic approach developed, it was Linda's third stop. Psychodynamic therapy differs from humanistic and cognitive behavioral models in its stress upon the role of unconscious motivations and childhood experiences.
Psychodynamic therapy is a way of doing therapy that's based on a model that identifies a recurrent pattern in the history of an individual and illuminates it so that somebody can get the idea, that's what we call the insight, that what they're doing is a repetition of something that they learned early on. We all learn early on in life, in our early primary relationships, how to adapt to another person. And frequently we take those early patterns and use them as models as we go on in life. Sometimes it works well. Sometimes we repeat things that aren't appropriate. It's not that they were never appropriate at one time in life, but they don't lead to what you might want to accomplish at a later stage in life.
You know, one thing that would help me, Linda, is to understand a little bit about your history. I wonder if you could just tell me something about just your family, where you come from, just the nature of your life growing up.
I'm the oldest of 5 kids, and I grew up in Kansas. Had really wonderful parents and a close family. We're very close-knit, still are. My father's passed on now, but my mother and my brothers, I have 3 brothers and a sister, younger than I am. And I was really the one who was helped out a lot, especially when my mother got pregnant. My brother was born when I was 10, and then she got pregnant again right away. And so I had another brother that came along when I was 11, and she was very sick the whole pregnancy. So I took care of the first one, John.
So in other words, you were 10. Your mother didn't have other children until you were 10?
No, I have one brother that's 2.5 years younger than I am. But I was the one that was the little mother and always was the helping person, loved to cook and loved dolls. And when my brother John came along and my mother was so sick, I took care of John a lot. And we're still very close. We used to have a special bond. Then my sister came along when I was 16, and I took her every place with me. She was like my little mascot.
But it sounds like people early on recognized your ability to be a good caretaker.
Evidently.
Once Dr. Brown had explored Linda's childhood, she turned to the subject of Linda's marriage and divorce.
In many ways, Linda, it sounds as if the fact that you had those years together and they, from your perspective, were so good, feels like you don't sit here today saying, I made this terrible mistake.
Oh, no, I would do the same thing all over again. I don't think I would change anything. The only thing I would maybe change is the last few years, and I would make him go into therapy with me somehow, or going to it myself and somehow make him deal with, he was going through really bad depression. And I think at a certain point he felt that it was just easier just to not deal with me anymore, or with his situation. He wanted to focus totally on his music And I'm not sure that I would have been able to change that, but maybe I would have known it was time to let go, because it wasn't my dream. He loves the attention, and I'm more a background person and supportive. And I could have done it if he was making a lot of money and I didn't have to work. But I couldn't do it when I was working, and I do enjoy my job. So, I think it was definitely time that it ended, but it was too abrupt for me.
So when you think about it now, does it seem as if there was a period of time when he was trying to break away from the relationship and he was more ready to go than you were, but you just didn't see what was happening at that time?
I don't think even he saw, no. I think he just was in his own space, and all of a sudden he wasn't, it's like he was complaining about things I did he never had done before, or, he just wasn't happy. And I knew that, but I didn't know how to fix it. I couldn't fix it.
But you're saying he wasn't happy and he was focusing his unhappiness on you, on what you didn't do right.
Right. And that's the first time in a marriage that had ever been the case. And that made it very stressful, of course, for me.
One thing I am curious about, when you said that he started getting very critical of you, and your response to that was that you would go to him and ask him what was wrong with him, or, like, why did he feel bad, or, and it reminded me again of how you've described yourself as such a good caretaker. It sounds like you weren't the kind of woman that would say, hey, cut this out, this is not okay with me.
Yeah, that's not me.
That you wouldn't do that. Rather, you would just, that your way of dealing with your discomfort is to ask him what was uncomfortable for him.
Right, and what could I do to make it better? I thought I could make it all better.
So again, there was Linda the caretaker.
Exactly. My previous patterns came out big time.
When someone like Linda comes across as having resolution, particularly, for example, that she recognized so clearly the notion of her role as caretaker, it was important for me not to intrude and push too far in terms of seeing how, even though she understood it, she didn't really see the depth of it. And I don't think she really has yet to see how much that has deprived her in life of being able to have a life that comes more from inside of her rather than is an expression of trying to please and be pleasing to the other person.
While these therapies have been proven effective, they are not equally effective for all types of problems. Some therapies are better indicated than others for specific disorders.
If people have particular types of problems such as depression or social anxiety or panic disorder, eating disorders, substance abuse, for particular types of problems like that, we now know that there are certain therapies that have been shown to be effective with those particular types of problem. We call these therapies empirically validated therapies. For example, depression, which is quite common, has been found to be treated effectively by cognitive therapy, by a therapy called interpersonal therapy, and by another therapy, a behavior therapy that focuses on improving positive events in your life. With anxiety, there are many different types of therapy for different types of anxiety. So, for example, with social anxiety, there's research evidence that group cognitive therapy is very effective. With panic disorder, there's evidence that cognitive therapy is effective, relaxation therapy is effective.
Another form of therapy that is useful for many disorders is biomedical intervention.
Biological interventions are really important in the mental health field. Medication has just taken a huge role in many of the major mental illnesses.
The one thing that psychotherapists always keep in mind is that there is research that shows that medication can be helpful for depression, for many types of anxiety, but the medication in and of itself may not be a complete treatment package. For example, with depression, what the research shows is that while medication can help, even without psychotherapy, treat a single episode of depression, that if people are also in cognitive therapy, they're much less likely to get depressed again in the future. So it seems that psychotherapy has a role in terms of teaching people ways to understand their problems and what to do about their problems so they don't have problems again in the future. But medication can be very helpful in the short term to relieve some of the distress that can be caused by depression, anxiety, and other problems like that.
Linda found her therapy sessions to be helpful in dealing with her issues. But would these methods have the same effect on a person from another culture?
We can say that the answer is yes, because we all experience certain feelings. It doesn't matter who we are. We experience pain, we experience joy, we experience sadness. However, each culture has a different way of expressing those feelings. Each culture has its own way of believing that somebody understands them. And if we were to think about the nature of psychotherapy, in that one person is trying to understand another, we would realize that among cultures, between members within a culture, that there are different ways of really understanding another human being, another person.
There's no question that each individual can benefit from the therapeutic process, but the therapy has to be tailored to the culture, to the belief system of the individual. A lot of the benefit of therapy comes from the belief in the patient that this process is going to help me.
I think it's actually more important that you bond with the therapist, and I think the personalities are the most important. For right now, I'm going to think about some of the insights I've had, and then possibly I'll go back into therapy for a while.